This annual enrollment period is going to be one of the most concerning and disrupting annual enrollment periods that we have ever seen. We're seeing some insurance companies completely pulling out of certain areas and leaving hundreds of thousands of people without plans moving into 2025. We're seeing plans that never had premiums before have premiums. And we're seeing record numbers of people reviewing their Medicare plan this year. In this video, we're going to break down 5 different tips that are going to ensure that you don't make any massive mistakes during this crazy annual enrollment period. Number 1, you need to review your ANOC. ANOC stands for Annual Notice of Change, and whether you're on a Medicare Advantage plan or a Medicare prescription drug plan, they are required to send you an annual notice of change in the mail every year, discussing all the different things that they're changing with your plan. And you can typically expect that to come in the mail around mid to late September. This year especially, it is crucial that you review that letter when it comes in the mail, because it's going to discuss all the different changes with the premiums on your plan, the co-insurance or co-pays on your plan. It's going to discuss the different networks, and it's going to discuss your maximum out-of-pocket changes. Being someone that owns an agency in the Medicare industry going into 2025, I have already reviewed over 200 people's plans, and I can tell you this without a shadow of a doubt. There are certain plans that never had premiums that are adding premiums starting in 2025. There are also certain plans that didn't have deductibles before, but now moving into 2025, they have deductibles, whether it's a health deductible or a drug deductible. I've also met with a record amount of people that are losing their plan. Their plan is no longer going to be offered in 2025, so they have to move to another plan, or they're going to be stuck with original Medicare Part A and Part B. But like I said before, this is going to be one of the most disruptive annual enrollment periods that we have ever seen. So it is extremely important to look over your ANOC when it comes in the mail. Number 2, make sure your doctor is staying in network for 2025. Unfortunately, here in Missouri, we had a major Medicare Advantage carrier completely pull out of one of the biggest doctor networks and hospital networks in the state of Missouri. And it's leaving hundreds of thousands of people without coverage if they go to their doctor. Now, there are 2 ways around this. The first way is obviously finding a new doctor that does accept your insurance. But I know that you might have built a relationship with your doctor, or your doctor has all your records on file and has been working with you for years, and you don't want to change your doctor. And so that's completely fine. The second option is shopping around with different companies that will have your doctor in network. However, that can be a very stressful process, and you shouldn't do it alone. What I would suggest is I would reach out to a professional that can help you make sure that you don't make any mistakes and make an even bigger mess of the whole entire situation. Now, on a side note, I know there are a lot of people out there that don't ever review their Medicare Advantage or their prescription drug plan, and they just let it roll over every single year. If I could encourage you, please review your plan, because there is so much changing, and you'd rather catch it now than be stuck not being able to see your doctor all year or having certain medications that are not covered for the entire year. Number 3, make sure to review your drug coverage. A lot of people out there that, whether you're on a Medicare Advantage plan or a Medicare prescription drug plan, don't even know that those companies can change what medications that they cover on a year-to-year basis. So your insurance company is allowed to change what drugs are on their formulary each year. And if you're not familiar, a formulary is a list of covered drugs that are considered covered on your specific Medicare plan. So moving into the new year, they could have taken some of your medications off and they're no longer covered, or they could have moved one of your medications to a higher tier level, so you have to pay for it now. Or we're seeing this a lot as well. Maybe your plan added a deductible and it didn't have a deductible before. So now some of your medications that you didn't have to pay for, now you have to meet a certain deductible before your insurance company will pay for them. We're also seeing a lot of plans that used to not have premiums that are now adding premiums, monthly premiums that you have to pay in order to have your plan. We're also seeing certain plans taking out pharmacies out of their network. And so maybe your pharmacy went out of network with your current plan. Drug coverage is always one of the top things that you need to review each year, because if you don't, you could be spending hundreds of dollars out of your own pocket next year when you really didn't have to. Number 4, review your extra benefits. I've seen almost every Medicare plan that I've reviewed is lowering their dental benefits or lowering their vision benefits or lowering their hearing benefits. I've also seen certain plans that used to have comprehensive dental and preventative dental, and now they're just moving to preventative dental to save money. I've also seen certain plans that this year we're paying for groceries or utilities or phone bills that are no longer doing that in 2025. They're completely scrapping that benefit off of the plan. So if you're a person that depends on that benefit, or you're a person that needs a lot of dental or new glasses every year, you need to make sure and review your plan, because it seems like almost every single Medicare Advantage plan is lowering their benefits, and it's at a rate that we have never seen before. Number 5, review your plan with a trusted licensed insurance agent. This might be one of the biggest tips that I have for you moving into 2025 and exploring this Medicare annual enrollment period. Because quite frankly, we are in uncharted territories right now, and 2025 is approaching quickly. Now, this is not a sales pitch. We're not trying to get you to call in. We have just seen so many ugly situations every single year that happen during the annual enrollment period. Whether you try to do it on your own and you switch to a plan that doesn't cover your doctor, or your medications aren't covered very well, or on the opposite side, you don't even review your plan and then your doctor's out of network or your medications aren't covered. We have seen some truly awful things throughout the years, and we honestly just love helping people, and we want to make sure you're on the best plan for next year. So I'm a firm believer that you shouldn't do it alone. And that's why in the description of this video, we have put a link to my calendar. Now, we are very, very busy and we don't have a lot of spots left. But if you want to review your plan with a trusted Medicare professional like us, feel free, click that link in the description. We'd be more than happy to meet with you. Like I said, we're very busy and there's limited spots. But if you want to, go ahead and do that now. And I definitely look forward to reaching out and helping you. We also don't charge anything to do it. It's completely free of charge. We'll check your doctors, your pharmacies, and your medications and make sure you're on the best option for you moving into 2025. That being said, I know it's a very difficult annual enrollment period. I know you're stressed about all the changes and you're not really sure what to do, but if you make the necessary changes moving into 2025, I still believe that you can have great coverage moving into the new year. However, if you're someone that's used to just rolling your plan over and never reviewing it year over year, you could be in for some ugly changes. So make sure and review your plan with a trusted Medicare agent and make sure that you're on the best plan possible. Now guys, thank you so much for watching this video. Please like, comment, and subscribe. And please feel free to leave a comment down below. What do you guys think of all these changes? Do you like them? Do you not like them? What are you worried about moving into 2025? Guys, thank you for watching this video, and I'll see you in the next one.